The member from London-Fanshawe.
Thank you, Speaker. My question is to the Minister of Health. This morning, patients in London are shocked to learn that elective surgeries have been cut by 2/3 for 2 weeks in a row. Wow. That means dozens of surgeries won't be done. Anyone with a loved one waiting for surgery will be outraged by more delays. And everyone in London has one simple question. Will the minister stop these cuts, or will he stand by while patients suffer?
Minister of Health, Long-Term Care.
Well, Mr. Speaker, thank you for the question. I appreciate it. And the member opposite knows that we aren't cutting health care spending. In fact, the percentage of government funding that goes into health care has increased year over year as long as we've been in power, Mr. Speaker, and that will continue going forward. So, of course, from time to time, hospitals are independent entities. They work closely with the LHIN, the local health integration networks within their localities. They make decisions based on not only the financial realities, the budgets that they've been provided with by the ministry, but also from time to time there are changes that happen. I don't know the specifics in terms of the occurrence in London, but I certainly will be looking into that. But our funding for hospitals, Mr. Speaker, has over the past decade has on average increased by 50%. We are making significant investments in our hospital environments, but the funding has increased by 50% over the past decade.
Thank you. Supplementary, the member from London West.
Thank you, Speaker. Despite what the minister says, this reduction in elective surgeries in London is just the latest in the growing list of Liberal cuts to London's hospitals. 52,000 nursing hours cut, 80,000 cleaning hours cut, $37 million cut. Frontline nurses say these cuts are having, quote, a horrendous effect on patients. How can the Minister of Health stand by and allow patient care to deteriorate in this way in London?
Well, Mr. Speaker, I don't allow that, and I have an expectation of all our hospitals that they maintain the highest quality of care and services that they're required to do. And I know also that they work closely with their LHINs to do that, with their local health integration networks. That is an expectation that I have, and certainly, as I mentioned, with the funding increasing year over year, not only the global health care budget, but the funding that we're providing to hospitals has increased by 50% over the past decade. Our hospitals are doing incredible work. We're measuring the outcomes. We're measuring the quality of services that they're providing. They are working to find efficiencies and provide innovations and develop and change programs so that they're able to provide even better care. I know they work in concert with their local communities, with the patients that they serve, and the boards that govern them, but certainly with the LHINs as well that have the responsibility for patient care and quality of care.